So it was in March of 2018, I was diagnosed with endometrial cancer. I had to go and see a surgeon, and she said, we'll do routine scanning. And I just said to her, working as a nurse, I felt a bit tired, and running upstairs, I was getting short of breath. So instead of just doing an abdominal CT, why don't we do a chest as well? I had a follow-up with my GP the following day, and he unfortunately got to tell me that I had not one type of cancer, but two totally unrelated cancers. So initially diagnosed with endometrial cancer, which was stage 1, and then diagnosed with metastatic stage 4 thymoma, which is a rare cancer. So I was off to go and see a gynae surgeon, who quickly decided that the best form of action was to do surgery to be curative of the stage 1 endometrial cancer. I had a radical hysterectomy, recovered from that, went and saw my oncologist and a radiation oncologist, as well as a cardiothoracic surgeon, and was told that my cancer was inoperable. The best plan of action was to go down the radiation and chemotherapy route with the hope that cancers would shrink. My oncologist said to me that I wasn't to go down this road unless I engaged exercise medicine. So from day 1 of my chemo and radiation, I started here at LIFT. So I'd go and have my radiation therapy, and then I'd come here, and everything was individualised to me, looking at getting my strength, my respiratory function, my muscle tone, in the hope that I would get well enough to be able to have surgery. I found that on the days that I had chemotherapy, the following day I was a bit tired, but day 2 was probably the most difficult. And so I fiddled around with the days that I was coming in for my exercise medicine, and I found coming in on day 2 reduced the nausea and the fatigue and that just feeling of walking through treacle that sometimes you get throughout your treatment. I used to train years ago 3 times a week with a personal trainer, and that was focusing on, flat abs or tight thighs and trying to look good in your bikini. Where coming into exercise medicine, it's more focusing on what you need to accent your treatment regime. Mine was fatigue, nausea, and that general tiredness from the radiation and the chemotherapy. But the end goal was to get better, looking at shrinking these tumours and looking at surgery to try and get that curative point. So the focus was on getting the strength, building up my abdominal muscles, not so I had a six-pack, but so after having surgery throughout my chest, I'd be able to sit up in the bed. The difference between them is one's kind of to look good and feel good and be fit, but one's to facilitate and accentuate your treatment regime and really push you into a better place to go through your treatment. I was fortunate enough that my radiotherapy, my chemotherapy did work. So I then went and had major surgery at the Royal Adelaide Hospital, which included cutting through my chest here and along through my back wall muscles, removing tumour and part of my lung. So I was left with quite a deficit. And yet again, it's like, well, you're going to need to have some more chemo. And by this time I know that exercise medicine is key to my recovery. After 12 months of me not having cancer, I had a recurrence. And so that was a difficult diagnosis. I got quite angry with that. But I thought, right, what am I going to do? Exercise medicine again. Came back here, hit it really hard, pushed through things, and really built myself up for surgery that I had to go to Sydney for. I had another big surgery, which involved intrathoracic and intra-abdominal heated chemotherapy, which isn't offered anywhere else in Australia, and it's probably experimental. I was only in ICU for 2 days. I was only in hospital for a week. And when I went to go see my cardiothoracic surgeon, he looked at me and he said, I can't believe you have recovered so well. And that's when I told him about exercise medicine. And he truly attributes that to my recovery. And so does the surgical oncologist that I saw. He also attributes exercise medicine to my amazing recovery. Coming into LIFT really gave me that lift. You're emotionally supported by the staff, you're assessed by the doctors who will say, how are you feeling today, what your fatigue's like, which strength you sleep, you get assessed with all that. You come and you're with like-minded people. We might not all have the same type of cancer, but we're kind of getting the same type of symptoms or experiencing the same emotional kind of journey. So you notice that each other's hair is falling out, or you might be a bit tired, or you have a laugh over something stupid that no one tells you that you lose your nose hairs and your nose drips. You all know about your hair falling out. So it's those little giggles and laughs that you can have with others that are having treatment. As well as the physios and the exercise physiologists, they understand that some days you're not great, other days you're good, so they give you that support as well. And there's always the doctors who ask you about your mental health and are checking whether or not you need to see one of the psychologists here. I did have a chat with Nicole prior to my initial surgery because we thought, well, it might not be an option, what then? But I was coping quite well, although one member of my family was quite upset with the diagnosis of cancer. So they came along and were using the psychologist here at Lift, and that was a great help. And along with the guys at the desk, it's a good laugh. You come in the morning, might be freezing out cold, and they'd be laughing on what kind of beanie Liz was going to wear today or what colour bandana. So you do, have that kind of camaraderie and people that are understanding of where you're going and what's happening to you. Being a nurse for 20-something years and predominantly working in high dependency in the intensive care setting, I had a very good understanding of the treatment of cancer and how it impacted on people's lives. Some people, it's a massive turnaround and, they jump head forward into life, and other people, it can be quite debilitating and it can change the way you look at life. I have been left with quite significant physical deficits, but there's other things that I enjoy. I go down the beach early in the morning and I appreciate those little things a bit more. I had got ribbed by a friend of mine on Sunday for having a glass of champagne at 11:30 in the morning, and I went, well, I don't see you that often. Let's celebrate that we're together. So it's appreciating those things. Some days are dark. I miss being a nurse running around on the floor, but I've channeled into a different career path now. Cancer's always going to be there because it's stage 4. I always encourage anyone with a diagnosis to look at exercise medicine and the support that you get here, and to look for the little things and embrace new things. Some days you get down. Sometimes I get frustrated with what I can't do anymore, but then I've got to think about what I can do. So you've got to smile, put the red lippy on and just push forward.